Sahasradi Kashayam, the only Kashaya which is mentioned by Ashtanga Hridayam Vadavyadi Chikitsa is Sahasradi Kashayam. Let us focus on the two terms Pavana Pidita Dehagadi and Druda Vilambitago Bhavadi Ichaya. So, Pavana Pidita Dehagadi means due to the Pida of Pavana or Pragupita Vada Dosha, there can be a gait disturbance or difference in the Dehagadi. For example, in musculoskeletal disorders, when the patient experiences pain, the gait will change into antalgic gait. In such cases, the Sahasradi Kashayam can be administered in a particular dose and for a particular period of time. And Acharya himself has stated that after the intake of Sahasradi Kashayam, he can regain the walking style or the gait, and he can walk according to his Icha, either Druda or Vilambita. So the spectrum of diseases in which this Sahasradi Kashayam can be administered are Gridrasi, Vadakandagam, Kadi Graham, Padaharsham, Janushulam, etc. So this doesn't mean that if a patient is having cerebellar ataxia, sensory ataxia, or Parkinsonism gait, and after the intake of Sahasradi Kashayam, all the pathology behind will get cured. So it's a logic of the physician to critically analyze the pathology of the condition and also to select the appropriate anupanam with which the Sahasradi Kashayam can be given according to the doshavastha, rogavastha. And broadly interpreting the Pavana Pidita Deha Gati, we can give this Kashaya as medicine with appropriate anupana even in Pakshaghadam, Manya Stambham, Jihva Stambham, and also Avabahuga Vishwaji like disorders. So in market, there is another drug called Adari Sahasradi Kashayam, in which apart from the ingredients of Sahasradi, the drug Adari is also used during the preparation. So this Adari Sahasradi Kashayam is purely a Adha Kaya Vishesha Kashaya. So maybe in Gridrasi and Vadakandagam, the Adari Sahasradi Kashayam will be having more effect than the normal Sahasradi Kashayam. So basically this Kashayam is Kabhavadaharam, Vada Anulomanam, and the Kashaya itself is Deepanam in nature. So give this Kashaya in Pitta Anubandha Avastha. So we can add Guduji along with the other ingredients. Guduji is also an anti-inflammatory drug. So, by judiciously selecting the most appropriate anupana for this Sahasradi Kashayam or the combination of other drugs with this Sahasradi Kashayam, we can administer in many Vadavyadis.